Hello, botched. This is term that is very commonly heard in the field of plastic surgery, and it is one of the reasons why people are scared to undergo plastic surgery. And among all plastic surgery procedures, probably the term botched is used most commonly with rhinoplasty. Hi, I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT, and Plastic Surgery, Bangalore. And today we will talk a little bit about what is a botched rhinoplasty, what is a secondary rhinoplasty, and we will look at one patient who had a secondary rhinoplasty to improve her nose after her first surgery, and we will see how that turned out. So, to begin with, what are these terms? What is a botched rhinoplasty? What is a secondary rhinoplasty? Well, botched isn't really a medical term, it's a kind of a slang, a lay term used to describe when a primary surgery, the first surgery, did not go as intended. It is typically used for cosmetic surgeries, and some of the common reasons in a rhinoplasty that a surgery can be called botched is one, if the appearance isn't looking good. So, if you have a hump even after the first surgery, if the nose is collapsed after the first surgery, if it is widely twisted and deviated after the first surgery, these are all examples of botched surgeries. The other example is if the patient is not able to breathe properly, means it looks normal but it's not functioning properly. The nose feels blocked, or you're having pain, or you're having continuously discharged. These are other examples. Now, what can be done for this? The surgery that is done to correct this surgery is called a secondary rhinoplasty. Secondary. It's the second surgery after the first rhinoplasty. Now, what are some of the reasons that a surgery can go wrong and that you would require a secondary rhinoplasty? One is that if the surgeon wasn't competent enough, if it is a surgeon who is not trained in that particular field, that could be one reason. Second is if there were complications after the first surgery. Any surgery can have complications. Infection, hematoma, these are all risks with any surgery. So in that case, if that happens after the surgery, even if the surgery was done correctly, the ultimate result might not be what we wanted. Third is if everything went okay, but then some untoward incident happened. For example, after a first surgery, someone got hit on the nose or someone fell down and they had a trauma. These again can spoil the results of the first surgery. And lastly, there are some rare complications wherein there were very rare things found inside the nose during the first surgery which were not predicted for, and so the original surgical plan could not be executed and you had to abandon it and do something else, because of which you could not do what you wanted to do in the first surgery. So these are all reasons why the first surgery could have gone wrong. Now, how can you protect yourself from this? How can you make sure that you have a good result? Well, the most important thing is to find a surgeon who is good at what they do. In the case of a rhinoplasty, a plastic surgeon is best for cosmetic corrections, and an ENT surgeon is best for functional corrections. At the Venkat Center, I'm the plastic surgeon and my wife is an ENT surgeon, Dr. Deeksha, and together we operate on all rhinoplasties. So always make sure you do your homework and check your surgeon's credentials before going ahead with the surgery. Make sure that they are a plastic or an ENT surgeon. Make sure that they have training in rhinoplasty, and you can also ask for their prior results and judge for yourself. So this would be the best way to go about it and be safe. It is the best way to have a good outcome is to have a good outcome on the first surgery. A secondary rhinoplasty is always much tougher. Now, why is a secondary rhinoplasty so much tougher than the first rhinoplasty? There are a few different reasons for this. One is there will be a lot of scarring in the nose. During a primary surgery, the first surgery, everything opens up beautifully. It is easy to dissect everything. In a secondary rhinoplasty, there can be a lot of scar tissue, things can be stuck together, so the dissection is a lot more difficult. Secondly, oftentimes you don't have a good record of what was done in the first surgery. So, to a certain extent, you're going in blind. You don't know exactly what you're going to find. So, you cannot plan for everything beforehand. You have to change your plan based on what you find inside. Thirdly, and very importantly, After the first surgery, the strength of the nose has gone down, it is weakened. So it is very important that in your second surgery, along with whatever cosmetic corrections you're making, you have to re-strengthen the nose, give support to the nose. And how do we do this? We do this by using cartilage. Now, in a primary surgery, use the cartilage from inside the nose itself and use that to do your work. But many times in a secondary surgery, that nose cartilage has already been used in the primary surgery. So you would need to take cartilage from some other part of the body. Some areas include the ear and the rib. Now, obviously, this makes the surgery bigger and more complicated because you're having to go to another area to get cartilage. So this makes the surgery more difficult. And finally, the last reason why secondary rhinoplasty can be more difficult is there might be some functional problems that were not there before but have come about because of the primary surgery. So, along with cosmetic corrections, you're also looking to improve the breathing of the nose. So, it's important that in any secondary surgery, expectations are realistic. The most important thing in a secondary surgery is to do all you can for that to be the last surgery. You don't want the patient to undergo a third or a fourth surgery. So, what does that mean? That means that along with cosmetic corrections, like I said, you have to strengthen the nose and give the nose back its strength. This is the most important. And because you have this additional component of where you're having to strengthen the nose, everything that is possible in a primary surgery might not be possible in a secondary surgery. You have to prioritize your requirements and then decide what exactly it is that you want to do. Now, when is the time to do a secondary rhinoplasty? I get a lot of patients who come to me 1 or 2 months after their first surgery asking for a correction. But that is not possible. You need to wait at least for 9 months, preferably a year after the first surgery before you attempt to do a secondary surgery. The reason for this is that you want the nose to completely heal from the first surgery. If it is still healing, if it is still inflamed, if there's still stuff going on inside, then your secondary surgery becomes even more unpredictable. You cannot predict how that will heal. So you need to let the nose recover completely from the first surgery. With this, one, it won't be as active as before. And second, you know what the final outcome of the first surgery is. So you know exactly what you need to fix. If you try to fix it too soon, then the nose might have changed in a way that you haven't accounted for. So you need to let the nose do its thing and then only try to do a secondary rhinoplasty to have the best chance of success. This can be frustrating for a lot of patients who are unhappy with their first nose and want to get it corrected quickly, but you need to be patient. Like I said, the second surgery should be the last surgery, and you need to give yourself the best chance of that being a success. Let us now hear from one of our patients who underwent secondary rhinoplasty with us after she was unhappy with the first surgery. You can see her images here. So, from the first surgery, if you see her from the side view, she has a hump which still remained after the first surgery, and she wanted that to be taken down. And when we see from the front view, we can see that the nose is twisted. The tip of the nose is moving to one side. So this is again her second thing that she wanted to be corrected. Let us hear from her now. This is our lovely patient after her splint removal. 8 days after surgery. She had had a rhinoplasty done once before and came to us for correction. She had a very twisted nose, and now you can see it is nice and straight. And on the side, she had a hump. You can see that is also straight. How are you feeling?
I'm feeling so good.
Are you happy with the result?
So much.
Thank you so much. Can you tell us a little bit about why you got rhinoplasty done again?
Because my nose was deviated and I'm not so happy with the result,
Okay.
which has gone before. So I want to correct it.
And how was the surgery? Was it very uncomfortable, very painful?
It went so well, not so much painful, just a discomfort.
All right. Thank you so much. Would you recommend us to other people?
Yes, definitely.
Thank you. As you can see in these images, our patient had a happy outcome and she's very happy with her new nose. From the side view, the hump has gone down and it is looking straight. From the front view also, the nose is looking straight. It isn't as twisted as before. And most importantly, the nose is stronger now and it will not twist and bend again. So that was our video on secondary rhinoplasty for correction of a botched first surgery. I hope you enjoyed it. Secondary rhinoplasty is a complicated topic. Often patients are very frustrated after the first surgery. They're angry justifiably that their first surgery didn't go correctly, which is why it's important that they approach their second surgery in a positive mindset. and they know what they want, and they are willing to wait, take the time, and do it properly. But as always, the best thing is to avoid a secondary rhinoplasty and get it right the first time. If you have any questions, do reach out to us. Our information is in the description below and will be coming on screen shortly. If you have any other videos that you would like to see, please let us know in the comments. Do share this video, subscribe to our channel, and click on the bell icon for notifications. Thank you. Have a great day.